So I hope आपने temporal arteritis, giant cell arteritis, you have watched that video. So now we will continue with the second kind of vasculitis which we need to know in slight detail. It is Takayasu arteritis. Okay. So there's a question at the end which you need to answer in comments. Do not forget to like, share, subscribe. So now let's focus upon Takayasu. Again, notes are there in description. You can check that link. Now Takayasu arteritis. So what is Takayasu arteritis? Basically, you need to know nothing about it. Okay, you need to just remember temporal or temporal say ditto, matlab it is more or like temporal only. There are only slight points of difference which we need to know. Okay, so first point is same. I told you in temporal also it is granulomatous vasculitis, here also it is granulomatous vasculitis. Okay, so this is nothing but same. Okay, so granulomatous vasculitis of large arteries, and it is characterized by ocular disturbance. There also ocular disturbances were there, here also it is there. One characteristic point which you need to remember in Takayasu which will differentiate is weakening of the pulses in upper extremities. Okay, so you will whenever patient will come to you, you will palpate his or her pulses. So basically you will feel that pulse is absent, so or it is very feeble. Okay, so it is also called as pulseless disease. So this is the characteristic point of difference. Okay, so you need to remember this point. Now what basically कैसे हम proceed करते हैं? First of all we learn about the basic, what is that particular condition, then what kind of vessel does it involve, right? So in temporal arteritis, please recall what vessels were involved. Entire temporal vertebral ophthalmic. Okay, here basically aorta and its major vessels are involved. Okay, so this is transmural fibrous thickening of the aorta and major vessels. Okay, so now what happens is there is severe luminal narrowing of which artery in this order, or most commonly is subclavian artery. Subclavian artery is the most commonly involved. Apart from it, carotid, brachiocephalic. Okay, so this is what is again a differentiating feature. You need to remember the vascular bed involved. Okay, so now the main characteristic difference is if any patient with such vasculitis like symptom, if it is greater than 50 years old, then it will point out to giant cell. Takayasu is a condition of young adults. Okay, it is like it is usually found in 20 to 30-year-old patients. Okay, so now if the age given into your MCQ question or in your practice is less than 50 years, then it will point out towards Takayasu. Okay, so just you need to remember this. Also now it can involve many vessels. Okay, it is not restricted to these vessels only, so it can involve any vessels and it can lead to symptoms for this. Okay, like pulmonary artery will be involved, so this will lead to pulmonary hypertension, है ना? So it can also involve these kinds of artery. So this is what you need to know. Now we will see the histology. So I hope these basics are clear. Just remember temporal से similar features and then some differentiating features. Now in histology, again a golden point given in Robbins is, first of all you need to know that histologically it is indistinguishable from giant cell arteritis. Okay, so जो histology giant cell arteritis में जो भी दिखता था, हम आपको याद है मैंने अच्छे से पूरा बताया था, same histology will hold true for Takayasu. So now this is basically a misnomer. जो temporal arteritis है उसमें giant cell arteritis आप उसको कह रहे थे, but giant cell is not specific just for temporal arteritis. Giant cell can also be found in Takayasu. Okay, is that clear? So now we will see its histology. So histology में यहाँ पे भी basically एक range होती है ना, एक range है. It can be either simple mononuclear infiltrate, है ना, as and when the situation will progress, it will become mononuclear inflammation, and if it will more progress, then it will be granulomatous inflammation. Giant cells are also found here, very important, please remember, and there will be patchy necrosis in the vessel wall. So this is all you need to know regarding the histology. Okay, so now what am I saying? This basically, this is what images are given in your Robbins. These are very gold standard image, one can say. So this, first of all, this is aortic arch angiogram, है ना, and you can see that basically there is narrowing and great vessels जो भी हैं उनका उनमें deposition के कारण subclavian, carotid, brachiocephalic arteries की narrowing हो गई है. Okay, so you can see that on the angiogram. Then there is also thickening, and due to which the lumen is reduced, so then the second portion holds true, and this is the third histological appearance, and in this we have shown nothing but mononuclear infiltrate and giant cells, right? So this is what you need to remember regarding Takayasu arteritis histology. So again, golden point, indistinguishable from temporal. So now as a doctor, how you will slightly differentiate? Again, golden point is age group. Okay, now in this the symptoms will be more vigilant because many arteries are involved. So constitutional symptoms तो होंगे ही होंगे. इसके साथ साथ BP will be falling because there is narrowing and there is weak carotid pulses. There is in the upper extremities. So this is what you need to remember as the clinical classical feature. Okay. Apart from this, ocular involvement can produce retinal hemorrhage, blindness, neurological deficits will be present. I have already told you, if pulmonary artery is involved, pulmonary hypertension can be found, and if renal arteries are been involved, then systemic hypertension can be found. So this is all you need to know, and the survival will depend on the progression. If the disease progresses very fast, it will be difficult for patient to survive, but usually if it takes a bit of more time, then it is by far manageable. Again, the therapy will be immunosuppression. So this is all you need to know regarding Takayasu as well. So these kind of scenarios, they are not required in much detail. Just know the click points, the extremely important points, and differentiating between various entities. So I hope these diagrams are clear. The question is this one. Kindly answer in the comments and let me know what topics do you want more videos on. Thank you so much guys. Stay safe, stay healthy, keep learning.